Hello, and thank you for joining me from the St. Regis Mohawk Tribe's Emergency Operations Center. I'm here today to share the most recent figures from the County Public Health Departments and to discuss an executive order that goes into effect at 8 o'clock this evening. For Franklin County, as of Friday, April 17th at 10:30 a.m., there are 12 individuals with confirmed cases of COVID-19, with an additional 60 people who are suspect, meaning a person that is diagnosed by a doctor positive due to COVID symptoms, but hasn't been tested. There are 115 individuals currently in quarantine, 226 people who tested negative, and 14 individuals who have recovered. For St. Lawrence County, as of Thursday, April 16th, there are 48 individuals with confirmed cases of COVID-19, with 104 total positive cases to date. There are 52 people who have recovered, and 3 hospitalizations to date, and 1 COVID-related death. For anyone interested in following these reports, you can do so on Facebook pages for the St. Lawrence County Public Health Department and Franklin County Public Health. Next, I want to discuss a New York State executive order that goes into effect today at 8 p.m. In an effort to contain the spread of COVID-19, Governor Andrew Cuomo has issued a requirement for all people in New York to wear a mask or face covering in public where social distancing is not possible, such as in retail or grocery stores. If you go to Walmart, you will notice signs and an employee at the entrance requiring customers to wear a face cover or a mask in order to enter the stores. These can be cloth face coverings and not surgical masks or N95 respirators, which must continue to be reserved for healthcare workers and other medical first responders. It can be a scarf, bandana, or made out of common household materials. There is a guidance on how to make your own face covering on the Center for Disease Control's website at cdc.gov. I have some examples with me today. This is an N95 respirator, and this is meant for first responders, such as myself. I'm a firefighter, and EMS, and nurses and doctors and so on. So this goes on around the back of the neck. It goes around the nose and mouth and goes over the ears. And then it molds into place in the nose piece. In order for these to be effective, you have to be fit tested, which we have a limited supply of. And it does take time to fit test those people who have to wear the N95 mask, and they are not going to be available to the general public. This is a surgical mask. This is what they give you when you walk into the clinic. Now this has a moldable nose piece, and this goes around the ears. You adjust it to fit your face, and then you adjust the moldable nose piece to get a better seal. With the surgical masks, you clean them normally, or this is actually disposable. And we have the cloth mask here, and both of these examples have a wire in here for a moldable nose piece. So please do not put them in a microwave. So this is made locally by one of our seamstresses. I'd just like to give a shout out to everybody that's helping us. And these can be washed, these can be reused, and that's examples that I have. There are other examples out there, such as handkerchiefs and scarves and other things that you can use for a mask when you're out in public. Please be mindful that the most effective way to prevent the spread of COVID-19 is to stay home. However, if you must be in a public place, please practice social distances and stay at least 6 feet from other people. In situations where that is not possible, wear a mask. To help you wear a mask or face covering properly, please follow these steps. Wash your hands with soap and water for at least 20 seconds before you put on the mask. If you don't have soap and water available, please use a hand sanitizer. If the mask has ties or elastic bands, secure the bottom first under your neck and tie behind your ears or wrap around your ear. Then pull the mask by the upper ties over your mouth and nose before securing. Make sure there are no gaps between your face and the mask, as it needs to fit snug. When you wear the mask or face covering, assume that the outside is contaminated, so refrain from touching it. If you do, repeat the process of washing your hands. When you remove the mask from your face, wash your hands with soap and water. You should always wear a clean mask, so wash your mask or face covering every time in hot water and regular detergent. Never microwave your mask, as some may contain a wire that can start a fire. With that, the first week of the homemade and N95 mask donation drive for Akwesasne was a success. On behalf of Akwesasne's frontline workers, Yawagoa, thank you very much to the following: Diane Swamp, Cheryl Jacobs, Terry Cree, Dr. Brittany Jock, and Jerry McCann, Yagana Galiosta, Nanolo, Mac, Ioanokwas, Thomas, and Ida Cameron. Your generosity and kindness remind us that we have caring community members in Akwesasne and that someone is always willing to lend a helping hand. Also, Yawagoa to CKON 97.3 FM for providing bingo packages to all individuals who donated masks. A huge Yawagoa to Dr. Brittany Jock, Jade White, Ashley Johnson, Allison Thompson, Clarissa Tarrant Shatland, and others who helped spearhead this donation drive. If you would like to donate a homemade mask, they are still being accepted at the Tribe's Social Services Divisions located behind the Akwesasne Housing Authority complex at 378 State Route 37. Homemade masks are being graciously accepted on Monday through Friday from 10 a.m. to 2 p.m. That is all the information I wanted to share with you this evening. Please watch for more updates from the Tribe's Emergency Operations Center on Mondays, Wednesdays, and Fridays at this time. Until then, for any COVID-19 related emergency matters, please call the Tribe's EOC at 518-320-0019 or the Mohawk Council of Akwesasne's EOC at 613-575-5005 or 613-575-2331. Yawa.